Malaria is a preventable and treatable disease. WHO says no one should die of malaria. In fact, it's unacceptable to record deaths that is being caused by malaria. Malaria is not just a health problem, but it's also a socio-economic problem to any nation. On today's edition of the program, our focus is on malaria. Plus, we have a feature on the health benefits of bitter kola, which is known as the wonder plant. I'm sure you enjoyed today's package. We'll go on a short break. When we return, you'll meet my guest. My name is Jane Nwokeji, and trust me when I say I love to do this with you every week. We'll be right back. My name is Jane Nwokeji, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by a pharmacist because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. If you're just joining us, the program is the #1 health program on the station for excellence, NTA Lagos Channel 10. My guest today is Dr. Jane Nwokeji. She is the Chief Medical Director, Healing Touch Hospital, and she's also a fertility specialist. But trust me, she's really grounded, and she's here with us today to tell us what we should know about malaria. Okay, you're welcome to Health Watch.
Thank you for having me on the show.
You look great.
Thank you.
This is the first time I've seen a doctor that is all so much swag, you know. You look great.
Thank you.
Okay, malaria is one disease that a lot of Nigerians will tell me that's common. Give us a brief understanding of what we should know about malaria.
Okay, malaria is a life-threatening disease that is caused by the plasmodium. It is inoculated in human beings by a female, infected female Anopheles mosquito. So it is caused by a mosquito, a plasmodium that mosquito inoculates in human being, especially just the female, infected female Anopheles mosquito that causes malaria. Malaria is a deadly disease, but in this country, most people think malaria is just ordinary thing. No. We have a lot of prevalence rates of malaria. The WHO record of malaria in 2020, October, said we have 100 million people infected with malaria in Nigeria and about 300,000 deaths from malaria. Why 100 million is infected, 300,000 deaths, which is a very big number of deaths. Compared to like HIV, AIDS, that is very low, okay? It's not that it's low, but HIV, AIDS has like 200 and something thousand deaths, while malaria has 300,000 deaths.
That's alarming.
It's alarming rate. It's very alarming. So because of it, today in World Malaria Day, the theme is zero malaria, starting from me and drawing a line between prevention, because malaria is treatable and death from malaria is unacceptable. You draw a line, malaria is treatable, is preventable, death from malaria is unacceptable. Okay, so in today's this, we need to know on malaria, what are the things you will do to prevent them from coming, complications you have when you have malaria, the most common type of malaria we'll have in this kind of environment, and things you should do for deaths not to occur when you have malaria.
I like the fact that you said that in Nigeria, people just look at malaria like it's one of those, they take it for granted. Let me use that word. What would you say are the factors that are responsible for the high prevalence rate of malaria in Nigeria?
We'll have different factors. We'll have the health condition factors. In the health condition factors, there are people that have kidney problems, liver problems, and they are having malaria. You have human factors, that's the age, the pregnancy, the elderly, the blood group / rhesus factor, that's genotype, because malaria is more in AA than in AS and SS. It occurs more in children of below 5 years. It's deadly in children below 5 years. And also malaria occurs more in pregnant women. So we'll put all those things into consideration. Environmental factor. There are people living in high populated areas where the place will have poor drainage systems, dirty areas. So those things we'll have to put it into consideration. In such places that are highly populated, most of the times you see stagnant waters containing empty containers here and there, and the mosquito breeds in it. And those areas that is highly populated, most of the places is very dirty, poor drainage system. They don't clear their bushes, and such things increases the risk of having malaria. So one of the things we will do to reduce such thing in Nigeria is we should look at, for us to be able to get the theme of this year, which is zero malaria, and drawing a line between malaria, which is preventable, and we don't want any deaths. That's zero malaria. The Nigerians have to be aware of the risk factor. That is the first prevention. If they are aware of the risks that are involved in having malaria, it will make them to know that prevention is better than cure.
Okay, doctor, before you go to the preventive measures, let's talk about, are there different types of malaria? If there are, can you just talk about it?
Yes, we'll have different plasmodiums that causes malaria. We'll have different, but the only one that affects human beings are 5. That's P, Plasmodium falciparum, Plasmodium nolens, Plasmodium ovale, Plasmodium vivax, and Plasmodium malaria. So those are the 5 that really affect human beings. But we'll have the high rates of P. falciparum in Nigeria. Most of the ones we have in African countries are P. falciparum. P. vivax, you have more of it in Asia and South America. That's where you have more of it. Then P. ovale, most of the times is asymptomatic. It stays years in the liver.
Wow.
Yes. It stays years in liver. And
so it could even affect the liver.
Yes, malaria stays in the liver. So one of the
complications.
Yes, that's
so
one
we'll
of the
that.
Yes. So the one we'll have more in is the P. falciparum. That's the one that is causing most of the death in the country.
We'll take a short break now. When we return, Health Watch continues. Stay with us. If you're just joining us, the program is Health Watch, reaching you from the #1 station for excellence, NT Lagos Channel 10. And I have a medical practitioner in the house with me, in the person of Dr. Jane Nwokeji. She is the Chief Medical Director of Healing Touch Hospital. And before we went on the break, you were talking about the types of malaria and very good enough. You also mentioned the most common type of malaria in Nigeria. Now, let's go to the complications that arises as a result of not treating malaria, or the one you mentioned that you said it could be hidden in the liver.
Yeah.
That's really scary.
Yes.
So let's talk about the complications of malaria.
Okay. Before we talk about the complications of malaria, you remember at the beginning, I said the way to prevent malaria is being aware of the risk, which are these complications.
Okay.
Now, malaria has a lot of complications which people don't know. We have what we call cerebral malaria. The malaria can enter the brain, causing the brain to have inflammation or swell.
Wow.
Do you understand? And it's a very severe malaria. Malaria can also enter, you can have it in the liver, causing liver failure. And when a patient is having that, you see the patient will have jaundice. What do I mean by jaundice? How will a layman know that somebody has jaundice? The white eye, the sclera of the eye, which is the white eye, will be yellow in color. The skin will be yellow in color. Will be yellowish in color.
Okay.
The white eye will be yellowish in color.
I actually thought jaundice is for just children.
No, jaundice is for one of the complications of malaria when it affects the liver, when it damages the liver. Okay? Malaria can also cause kidney failure. It can cause kidney failure. It can cause you to have shock when there is a drop in blood pressure. Malaria can cause you to have anemia. And you know what? You can have anemic cardiac arrest. So, malaria, once you know the risk factors that can occur when you have malaria, it will make you to do everything possible to prevent having the malaria. Okay? Now, we'll have what we call dehydration also. We'll have what we call pulmonary edema, whereby you have the fluids in your lungs. You have fluids in your lungs. And when you have that, it can lead to what we call ARDS, acute respiratory distress syndrome. The patient will not be able to breathe well. And you have to resuscitate, put the person on oxygen and do the necessary interventions. So malaria, when it occurs in a pregnant woman, it has a lot of risk. The person can have premature birth, delivering a child before 37 weeks. Some people will deliver at 20-something, that the child will start needing incubator and other interventions too. It can lead to low birth weights. The person will give birth to a child with a low birth weight. It can also reduce the growth of the child in uterus. Growth retardation. When you give birth to the child will look small. Okay? Malaria can also cause the death of the child and the death of the mother. So these are the complications of malaria, which we don't want to have. That's why we want to have zero malaria. And once you know this complication, like we usually say, that prevention is better than cure. So because you've known the complication that can occur from having malaria, you do everything possible to prevent yourself from having that. What are the things you need to do to prevent yourselves from having that? One, clearing of bushes around the house. It's a simple thing. Any grass growing around your house, you clear it. Removing of stagnant water. Putting nets at entrance of the windows and the door. Put nets at the entrance of the windows at the door. Sleep under mosquito-treated nets. You can use mosquito repellent cream, it's okay. You can use insecticide, mosquito insecticide. Then the drainage system, we need good drainage system in this country. It will also help to reduce harboring of mosquito larvae. Okay? Then the gullies can be cleared so that there will be free flow of water. It's very important. You can also introduce fishes at the ponds. Where you have ponds, you introduce fishes in the ponds. The fishes there will help to eat the larva of the mosquito, thereby reducing mosquito. You can also spray oil or kerosene on surface of the water. So with the oil or kerosene on surface of the water, it will help to reduce the breeding places for the mosquito. So with this, if we're able to do this, we'll be achieving our aim. And that is what we want. That is what the World Health Organization is looking at. Zero malaria. And we can do it.
You see, thank you so much. This is one of the things we do on Health Watch. We bring you professionals, those that are qualified and have experience enough to share with you whatever question that's been bothering your mind on different health issues. And she has given us a lot today, talking about the complications, risk factors, and then moving on to the preventive measures. That's a very good one for us today. Now, very quickly, ma'am, what would you say is the reason for this, would I call it resistant malaria? You see some people having malaria constantly. So the person says, I was treated of malaria 3 weeks ago. I have malaria again.
Okay. Coming to your question, first of all, when somebody says he or she has malaria, you ask the person, what are the signs and symptoms you are having? You know, malaria comes with a lot of symptoms. Chills, fever above 38 degrees centigrade, some people headache, pain at the muscle pains or joints. In kids, you usually see them come up with diarrhea and vomiting. Even at that, those signs are not only for malaria. Do you understand me? Somebody can present with these signs and he's telling you he's treating malaria and he has treated malaria and it has refused to go. Have you done the necessary laboratory investigation? You need to do the laboratory investigations to be able to know, is this thing malaria or other things? You know, in malaria, we'll have different types of laboratory investigation. We'll have what we call thick and thin smear test. That one is very good because it gives you the particular species that is involved, the parasitic species that is involved when you are dealing with malaria. We'll have what we call RDT, that's rapid diagnostic test. In rapid diagnostic test, it doesn't give you the species that is causing the malaria. It's just a quick test. It just shows you positive or negative. That's what it does. It doesn't show you whether it's P. falciparum or vivace or this. You won't know. But it will just show you positive or negative. And we'll have molecular tests, which is a polymerase chain reaction test. We'll have antibody tests. These are tests for malaria. Those antibodies tests will be able to show you if the patient is having an antibody, it shows the patient had malaria recently or just treated recently. That is why you have the antibodies in the blood. Then we'll have what we call drug-resistant test. In that, you do the test to know the drug that particular malaria is resistant to, so that it will help you to know the one to give. That is why it's very important when you have any of the symptoms mentioned before, you should go to hospital and see your doctor, because your doctor will be able to know. You might be taking a particular malaria drug and it's not working. It might be that the system is resistant to it. So with the drug resistant test, they will be able to know the particular drug to give to you. There is another thing we do. We do what we call CBC, blood count.
Okay.
You do blood count In that blood count, it will show you whether the PCV is high or low. In somebody that have malaria, severe malaria, the PCV is always, it drops below normal, because malaria affects blood. That's why you have anemia, which is one of the complications. So with this test, we'll be able to know what this patient is treating, what this person is treating. Is it malaria or not? Because some people might have symptoms that mimic it and it is not. So the doctor will be able to run other tests and he will tell you, no, this is malaria or it is not malaria. It's very important. So when a patient is sick, it's necessary the person should see the doctor.
A lot of take home on today's episode. First, malaria has a lot of risk. Malaria can be prevented, and from what the doctor just talked about now, ensure you get tested. Ensure you go for a diagnosis. Don't just assume it's malaria. It could be some other thing. Moving forward, just in 60 seconds, what's your word of advice to everyone?
We should try and prevent malaria, because prevention is better than cure, like we usually tell our patients. So they should prevent malaria, do the preventive measures, clearing of bushes, using mosquito-treated nets, and mosquito repellents, creams, insecticide. Clearing your drainages is very important. So with that, you'll be able to prevent malaria. And once you have the symptoms, please see your doctor. With that, we'll also be able to prevent drug-resistant rates we are having, because people are used to running out to buy self-medication. And they will tell you, I treated malaria last week and this week I'm still having malaria, which is not good. So you see your doctor, your health professional, who will be able to make a diagnosis and give you the right treatment for malaria.
Wow. This is actually a total package. Thank you so much, Dr. Jane Nwokeji, the Chief Medical Director of Healing Touch Hospital. I know that I put you on that pressure, your tight schedule, but you still found that time to come out to share this information, to educate us and to inform us on what we need to know on malaria. Thank you so much.
You're welcome.
Up next is our feature on bitter cola. Enjoy it. We'll be right back.
Cola, popularly known as bitter cola, is a multi-purpose tree indigenous to West and Central Africa. In Nigeria, it can be sourced mostly from the southern part of the country in the following states: Ondo, Enugu, Osun, Imo, Oyo, and Ogun State. Bitter cola is called Akuilu by the Igbos. The Yorubas call it Orogbo, and it is called Nomijingoro in Hausa. The highly preferred species is called wonder plant because of its parts that can be used as medicine.
Bitter cola is a very good root that cure many things in the system. A clear heart, also good for cough, also good for curing of fibroid, hepatitis, and so on. The bitter cola is also antidote for poison. While it is very good to reduce weight.
Just like the popular saying that too much of everything is bad. Despite the health benefits of bitter cola, it also has its side effects.
The disadvantages of it, when you eat it too much, it can cause mouth odor. Also, it can cause low sperm count. Then the bitter cola, it can cause glaucoma, as in when you eat it too much. Also, it can cause mouth cancer.
Although bitter cola has been eaten in Africa for years, scientists are just beginning to study the health benefits of this flowering plant. There is no doubt about its medicinal benefits, but caution must be applied when consuming it.
Okumi, that we brought you a total package today, from the complications of malaria to the preventive measures. And of course, the doctor also talked about the importance of going for a test. Don't just sit at home and assume that you have malaria. See a doctor. Interestingly, she also enumerated the signs and symptoms of malaria. For your inquiries, for questions, send a mail to us on kibenkem@gmail.com or ntalagos.channel10@gmail.com, or send a text only to 07060865487. Remember that health-conscious people live longer. My name is Nkem Okibe. Join us same time, same station next week. See you then.